it going? Oh, okay. Today I'll be palpating the medial portions of the knee. And first we have the joint line and the meniscal window. And we're going to have our patient laying supine with their leg bent at the knee joint. And I'm going to grasp the proximal posterior lower leg with my fingers. And I'm going to find the patella tendon, and I'm going to place both of my thumbs on either side of the patella tendon, and I'm going to follow the depression medially and laterally, and in the depression is the joint line. Next, I'll be palpating the medial tibial plateau, and our patient is supine again with her leg bent at the knee joint. I'm going to grasp the lower leg from the front with my fingers in the popliteal area, and my thumb is in the depression of the joint line. And if you press inferiorly, I will be palpating the tibial plateau, and on the medial side of the patella is the medial tibial plateau. Next, I'll be palpating the tibial tubercle or the tibial tuberosity. And the patient is still supine, and if I follow the infrapatellar tendon distally, it will insert on to the bony prominence, and the bony prominence is where it inserts is the tibial tubercle. Okay, next I will be palpating the medial femoral condyle, and the patient is supine with the leg bent at 90 degrees at the knee joint, and I'm going to place my thumbs in the meniscal window again, and if I press upward on the medial side of the patella with my thumb still in the joint line, I will be palpating the medial femoral condyle. Next, I'll palpate the medial femoral epicondyle. So the patient is supine with the leg bent at the knee joint, and beginning on the medial femoral condyle, I'll palpate medially, and I'll feel the sharp edge of the medial condyle. And if I palpate further medially to that, I will be on the medial femoral epicondyle. Next, I'll palpate the adductor tubercle, and I'll begin at the medial femoral condyle, and I'll palpate, well, that was really country, medially and posteriorly until I feel a bony prominence at the distal end of the natural depression between the vastus medialis and the hamstring muscles, and this is the adductor tubercle. And next, I'll palpate the medial meniscus. So the patient is sitting with the leg off the edge of the table, and I'm going to internally rotate the tibia and palpate along the medial joint line. And with internal rotation, the meniscus pokes out a little, and you should be able to palpate a soft prominence, and that is the meniscus. And lastly, I'll be palpating the medial collateral ligament. And the ligament itself is not distinctly palpable unless there are symptoms. And to palpate the region of the MCL, I'm gonna locate the medial joint line in the meniscal window and move medially and posteriorly along the joint line. And this should be the region of the MCL. And it will become very tender when there is a sprain. And if a defect is felt, it usually indicates a tear of the MCL.
Today we're going to be palpating the pes anserin. So what I'm going to have to do is the patient's going to be sitting on the edge of the table. For now it's just a stool, and we are going to have them flex their knee, and then I'm going to help them hold their legs securely with my own. So I'm doing that right here. Then I'm going to palpate the tibial tuberosity, moving it slightly medially and posteriorly. I'm going to ask the patient to flex their knee with resistance, and that's actually going to create the tendons to be more prominent in the leg. Know where to feel them. And this group of muscle and tendons is actually known as the pes anserin. This is just medial to the insertion under the tendon that lies with the pes anserin bursa. Now we're going to be learning about the lateral positions of the knee. For this one, we're going to be doing the lateral tibial plateau. Not for now, but the patient will be laying supine. We're going to have her bend her knee, and then we're going to grab their lower leg from the front, and with the fingers in the patellar and the thumbs in the depression of the joint line. If you press right here, that will be the tibial plateau. And then if you palpate on the medial side, which you've seen before, that is also the medial tibial plateau. Next is the lateral tubercle. We're also going to have the patient laying supine and their knee bent so that we can palpate this part of the knee. As you can see right here with your thumb, you can actually feel this larger portion of her knee, which is the lateral tubercle. Next, we're going to be doing the lateral femoral condyle. First, what we're going to have to do is have the patient laying supine, and then we're going to bend their knee past 90 degrees, so by right there. Then we're going to palpate the smooth surface of the lateral femoral condyle, which is you go find the patella, then go right below it and laterally. And right here should be the lateral femoral condyle. Then we're going to do the lateral femoral epicondyle. We're going to have the patient, once again, in supine with the leg flexed past 90 degrees. And we're going to palpate just right underneath the femoral condyle. And that's going to be right here. Next is the head of the fibula. You're going to actually go from the last palpation, which was the lateral femoral epicondyle, and you're just going to move laterally along the joint line. And right here is the head of the fibula. Next is going to be the lateral menisci. What we're going to have to do is the patient's going to be laying supine with their knee slightly flexed. Then it's actually going to be easier for the patient to be in this position for you to be able to palpate it. You're actually going to probe firmly on the lateral joint space with your thumb, and you may be able to feel the posterior margin of the lateral menisci. So that should be right there. Now we're going to be doing the lateral collateral ligament. What I'm going to have to do is the patient's going to be sitting at the end of the table, and then I'm going to have her take her leg and cross it like she's just sitting normally on her knee. And then what you're going to do is you're going to palpate on the lateral side of the knee, looking for a sort of like a tough ligament, sort of band-like, which will be the LCL. So it should be right here.
I'll be finishing up the lateral palpations of the knee. You're going to have your patient supine and the knee flexed at 90 degrees. And what you're going to do is you're going to find the lateral side of the knee and find the head of the fibula, and the biceps femoris will be right about there. Next, we'll be doing the IT band. You're going to have your patient seated, and for the first one, you're going to have them dig their heel into the ground, and it's going to be on the anterior lateral side of the knee, and it's going to be right here. And then next, you're going to have your patient extend the knee fully, and you're just going to bring it up, and it's going to show a little bit more, but it will be right here in the same anterior lateral spot. And then next, I have the common peroneal nerve. You're going to find the head of the fibula, and it's going to be right across the neck of the fibula. Now I'll be doing the anterior palpations. I'm going to be palpating the trochlear groove. What you're going to do is you're going to find the patella or the kneecap, and all you're going to do is slide it laterally or medially on both sides, and that will be the trochlear groove. Now I'll be doing the patella. It is the large sesamoid bone. You're going to glide it across the knee joint, and it's commonly called the kneecap. Now I'll be doing the quadriceps tendon. You're going to find the end of the quadriceps in the superior pole of the patella, and it's going to be palpated right about there. I'll be doing the patella tendon. It's going to be on the inferior pole of the patella, and it's going to insert on the head of the tibia, right about there. And lastly, I'll be doing the tibial tuberosity. If you find the patella tendon, you're going to go inferiorly, and you're going to find the bony prominence right about there.